everyone, and welcome back to Hot Coffee, Hot Topics. My name is William Urbanik. I'm a financial advisor, a managing partner here at SecondHalf Coach Wealth Management. And with us today is guest Allison Clayton of Insurance Services. And Allison is one of our strategic partners. And strategic partners are people we work closely with to provide our clients a holistic experience. We're a big believer that the jack of all trades is the expert at nothing. And we don't pretend to be the expert at health insurance, but we know somebody who is, and that's Allison. So Allison, could you tell us today how you got started in this business?
Sure. So I was out of college and trying to decide what I was going to be doing, and I had a friend that was actually in the insurance industry, which I never thought that I would be in, but he said come along with me to a meeting with some clients, so I did, and as soon as I sat in with him at that first meeting, I realized that it was something I wanted to help people with because Medicare is so confusing and there's lots of layers to it, and it's basically like educating your client. So I found that that's something that I love to do. I always actually originally wanted to be a teacher, so kind of fits right up my alley.
In many ways, you are a teacher.
I am.
You just teach different topics to a little older student base.
That's right.
Well, I can relate to that. So, Medicare it is something that I have found in 20 years of doing this that people get confused of. And when people are confused about something, they get afraid of it. And they're almost just kind of push it away and just, kind of push it under the rug because they don't want to deal with what is, confusing or unknown to them. So as many of you know, Medicare is one of a couple main entitlement programs that the United States has for senior citizens. And it is something that started with, going back to an idea that Theodore Roosevelt first posed in the 1912 presidential election. And then it was something that Harry Truman talked a lot about and during his presidency, the need for a national health care system after Social Security had been passed. President Kennedy even brought it up in an election when he had read, or after his election, after he had read a study that said that 56% of Americans over the age of 65 did not have health insurance. And then it was President Johnson who, like many things, took some of Kennedy's ideas and brought them to fruition and passed Medicare in 1965. And the first recipients of Medicare benefits were actually former President Harry Truman and Bess Truman, who had, brought that, that the need for this to light a few years prior. So, so Medicare is something that is very complex. It's something that scares a lot of people and confuses a lot of people. There's a lot of things to it. It's changed a lot over the years, such as Part D being added, Medicare Advantage plans. Nixon changed Medicare to include people with long-term disabilities and people dying of renal failure. So there have been a lot of changes. And when there's a lot of changes to something, you need somebody who stays up on these changes, somebody who's an expert in that field that you can trust to guide you through the convoluted paths of this major entitlement program. And that's why we use Allison. And Allison, could you explain to our viewers, if they were to come to you, what to expect? Like what type of expertise do you have, and how do you guide them in this area?
Sure. So something that I always make sure that I do is explain the different programs that you have available to you with your Medicare, which is your original Medicare that comes from the government, because you get bombarded with things in the mail, different programs. There's what's called Medicare Advantage, and then there's a Medigap plan. And those two types of supplements work very different from each other. So I always make sure that people understand how they work differently, go through their medication list, their doctor lists, go over things like if they travel or not, and then decide, based on those things, which plan may work best for them. And something that I make sure that I do with my clients year after year is go through changes. So there are changes annually, sometimes with specific plans or sometimes with the whole Medicare program. So I make sure everyone's aware of those changes, especially if there's something specific like a drug change to the formulary, the drug list, that they know about that, in case it affects them directly. So we always go through that, and annually I'll check in with my clients to do so.
That's great. One of the things that frustrates me a little bit over the years, having done this now for 20 years, is people will come in and they'll say, my cousin did this, or my coworker did this, my sister told me to do this.
Right.
And they're trying to apply some sort of rule of thumb to their own situation, which I know that that's not how things work. Do you find that to happen in your case too, where people are coming in with kind of a preconceived idea of what to do simply because it's what somebody else did?
Yeah, for sure. I mean, that's almost every single person that comes in because they talk about it. They go to dinner together, they have a conversation on Medicare, and three people have different plans and different opinions on what, is the best plan per se. And when people say that to me, the first thing I always say is that, yeah, but is that you? Do they take the same medications? Do they do the same things that you do every year? Do they have the same, illnesses or whatever it may be? So yeah, I always like get a laugh in our conversation. I'm like, I know your best friend has this and your sister told you to do this, but let's talk about, your specific situation first.
Do you find that it's prescription drugs and what people take on a regular basis as being the driving force really behind what plans they go with?
Yeah, a lot of people don't realize that, but it is one of the biggest things that's different on some of the plans. Like, for example, just someone that I looked at this past open enrollment, on one plan that she wanted, her medications were going to be about $1,000 per year, and another plan that I was going to suggest, they were actually $0. So that's a big difference between the plans, and people don't think to look at that first as something that is important, and it's one of the most important things I found over the years to check on.
So Allison, you agree with me on the frustration of people trying to apply rules of thumbs or what their neighbor or friend did to their own situation. Can you give us another example of where you have kind of taken somebody who was really going down the wrong path with something and you were able to steer them correctly?
Sure. So a lot of times, if they do sign up for a plan on their own, a Medicare Advantage plan that their best friend has, and then they start picking up their medication at the pharmacy and they realize there's a substantial difference in costs, and they can't afford that price for their prescription, but they're stuck in that plan for the year. So things that I can do to help with that, and that I have helped and I continuously help as things change with it, are the patient assistance programs available for medications. Each manufacturer and then third parties also have things based on their diagnosis or their prescription that they're taking. So I've helped a lot of clients over the years sign up for these programs where they might be paying $150 or $300 a month for medication and bring that down to maybe 40 or 50 or even $0 in some cases.
It makes me wonder sometimes because of how much is out there that we really don't know about, like you just mentioned, to make sure you get on the right track. How people really know what to do if they're not seeking out someone like you for guidance. Do you find that, do you work with anybody after they've already made these choices and are finding like, man, this can't be the best road for me, and you kind of get them steered right? So it's not just about the initial like, okay, we're eligible, let's get started. Do you find yourself working with people who are, say, 70 and they've been on Medicare for 5 years and they're like, man, this can't be my best option?
Yeah.
Can you talk a little bit about that?
Sure. So if I meet with someone who did come to me for the first time and then, they tell their sister to come and they are 70 and come in, those are probably some of my favorite situations because I can say, hey, look, you're doing this. And this is probably way better for you. Let's see if we can navigate to that. Where I've saved people, just some examples, basic numbers. Some people that are in their 80s or 90s, their kids start coming to me when they're turning 65. And then they'll say, can you help my mom? And then she comes in and she has a plan that might be, high premium, like $250 or more a month. And she's just afraid to move because when you've had a plan for 20 years with your Medicare, you don't want to move that unless you know that it's okay to do. So they've come in and we move them down to save, over $200 a month, and those kind of things, that's where they're in tears saying, wow, now I can afford this or that, or help out my son or daughter. So.
And from someone on my side of the fence who works with retirees, who many of them are on a fixed income, but in seeing their expenses go up in a variety of places, and no more so than today, as price of everything has gone up. Saving a couple $100 a month, $100 a month, $50 a month by changing plans is impactful, and I'm sure that's very rewarding for you.
It is. And I think the main thing to understand too with that is that I don't just change someone because it's a lower premium plan. It has to follow the other parts of it too, like the medication lines up, their doctors line up, it's within the same coverage that they're comfortable with, number one. But with the changes lately with the Medicare Advantage plans especially, what happens is they create new plans instead of changing the old plans. So a lot of clients that have had the same plan for 20 years or 15 years, their plan doesn't change much. It kind of creeps up where there's new plans available to them that they're not going to become aware of unless someone, goes over it with them and is able to navigate them. So
Right. Now, going back a little bit, I think one of the questions I get asked a lot is when should someone start thinking about, Medicare?
Sure.
Obviously they're eligible at age 65, but when do you think they should seek out guidance from you? Is it age 64? Is it waiting till you're eligible? Because there's so many changes, maybe you don't want to guide them too soon.
Sure.
And when would they apply?
Well, I think a good timeline is about 6 months ahead of time to just kind of navigate, what's available, what type of plan they might be seeking out, just kind of get a basic cost estimate.
Okay.
Anything before that, I do have people that come to seminars 2 months ahead of time too, or 2 years ahead of time.
All right.
So it just depends on what they like to do, but I think 6 months is a good estimate. That's when they're going to start getting blasted with things in the mail, be a little confused. People are going to start to give them opinions at that point, what they should be doing.
Sure.
And a lot of people too at that time are deciding whether or not they're going to retire.
Mm-hmm.
So all of those things and the cost structure and what coverage has to do with that. So I think 6 months is a good timeline.
Now, how would they go about applying?
For Medicare?
Mm-hmm.
So there's a couple ways to apply for Medicare. The easiest, if you're tech savvy, is to go on the Social Security website and actually apply. It takes only a couple minutes to do. Super simple. I walk people through it all the time, over the phone even.
That's great.
And then the other way is applying through the office locally or doing it through a phone conversation with them. Now, Social Security usually takes 4 to 6 weeks to get you in a phone call. So the easiest way is, of course, to do it online.
That was going to be my follow-up. I've heard stories about it not exactly being accommodating to people's needs and the ability to get somebody on the phone to answer questions, which obviously, fuels why you're so important in people's lives. Do you have any, as somebody's approaching Medicare in that age and considering this, what would you say is before coming to see you, what do you need them to have ready? You don't want someone to come to an appointment unprepared, because then, no one wants to waste your time, their time. So for someone to come to an appointment with you to discuss this and for them to get the best of you, what do you need? What do you need them to have prepared?
Again, their medication list is important because, like I said, that conversation can go 1,000 different directions with the person depending on what they're taking. Their doctor list, and then just basic information otherwise. Are they going to travel? What are their plans after retirement? And, what are they going through currently? Is there anything major, health-wise that they're dealing with? Because that can steer us too. But other than those 3 things, I have everything available as far as, comparing the plans and giving basic education on their options.
Okay. Well, Allison, thank you so much for that information and for joining us today. And thank you for being willing to join us again on January 26th. That's going to be a great event. Like I said, Allison will be there. Other speakers will be there. Lunch will be there. All right. So I know you all want to come out for that. January 26th, 9:30, St. Vincent Life Series. Come see Allison and other speakers. To RSVP for Life Series is very easy. All you have to do is call the office or go to our events page on our website. And Allison, thanks again for being here. See you in a couple weeks.
Thanks for having me.